everyone, I'm Dr. Amanda Zarriello from Restore Physical Therapy in Cranston, and today I'm going to talk to you about back pain. Back pain is one of those things that everyone gets at some point in their life, and it's the number one reason to go to the doctor, and it's the number one cause people miss work. So it's really something that we need to be treating better, and the message in this video is about back as a multifactorial, holistic way to treat back pain versus just one thing. I'm going to talk specifically about the lumbar spine. We have our whole spine is our neck, thoracic, lumbar, pelvis, but low back pain is one of the most common reasons people come to see us. And we often obsess over what is structurally wrong in our back. So when we have back pain, people want an answer. They want to know what is causing the pain, what joint, what ligament, what muscle, what nerve, what disc is causing the pain. But reality is that is usually not the cause of our pain. And I'm going to share that when you get an MRI is a way to look at your spine and see what's going on, what picture is going on. And oftentimes people with arthritis, stenosis, disc herniations, they might not have any pain. It might be an awful MRI and have no pain at all, although, and versus someone who has a healthy spine has a ton of pain. So what the structure looks like inside doesn't necessarily mean why you're having pain, and we need to know that other factors can contribute to why we're feeling certain things. Our lumbar spine has 5 vertebrae and discs that are in between each vertebrae. And the thing about the discs are they don't have their own blood supply. And that is why when we sit all day, we tend to get that like stiff and achiness in our low back. Sitting is the new smoking, they say. So sitting for 8 hours a day is the number one cause for low back pain. And that is because movement is what creates blood and fluid and oxygenated cells to go into those discs and those areas that can contribute to back pain. We also have nerves that come out of our spine. We have muscles and tendons and ligaments that all can be a contributor to why you have pain. But sitting all day is the number one reason why people have low back pain. But that's not the only reason. A lot of times patients' lifestyle can contribute to back pain. So if they're having a stressful week or month or something that is happening to them, that tension is staying in our muscles. So if someone is more in that go mentality, stressed out state, and they're not able to get into that relaxed state, that rest and digest, their tissues aren't able to heal and recover. So when you have back pain, you don't want to just think about what caused my back pain, but what else in my life could be contributing to it? Is something big, a big transition in life, a big change in life, not sleeping? Those things can contribute to how our back feels. Fear of movement is another cause of back pain. So a lot of times people will come and say, I bent over to pick up a piece of paper and I threw my back out. And so now, because that hurts, they are scared to bend over and pick up that piece of paper or anything off the ground. And so their body kind of creates this messaging that bending over is bad for me. But that is not the case. Bending over is good for us. We should be able to bend our spine, we should be able to flex, we should be able to extend, we should be able to side bend and rotate. But perhaps your muscles aren't strong enough, or you just weren't moving as effectively as you could during that time, or you also had a lot of stressful things going on in your life that contributed to things just tightening up and creating tension on your nerves, your discs, your tissues that can elicit pain. So when it comes to treating back pain, the way you think about your pain is very important to how you heal, because pain is a signal that is telling us that it needs attention. It doesn't mean that something is broken. So our bodies are resilient. They're able to heal if they're getting the right rest, the right recovery, the right stability, and the right mobility. The lumbar spine is really only meant to bend and extend and side bend. So if you're limited in rotation in your thoracic spine or your hips, you might be compensating at your lumbar spine. So making sure that the joints above and below that low back area are moving the way they should is also going to help prevent back pain and fix the problem of why one part of your body is taking more stress. So when it comes to treating back pain, it's figuring out what stressors in your life are contributing to tension that you're holding in your body. What movements are you avoiding that's also causing an imbalance in your muscles? And then what areas of your body are stronger, weaker, tighter, that is creating like just an inefficient system of the musculoskeletal system. So back pain is multifactorial. We don't need to stress over what structure is causing the pain, but really looking at all those factors of what's going on in your life to address that. Thank you again, Dr. Amanda Zarriello from Restore Physical Therapy.